Good morning. Welcome, everybody. And welcome to the people that are watching us on the web. My name is Mary Ann McCabe, and I have the privilege of chairing this workshop. I'm a member of the forum. I represent the Society for Child and Family Policy and Practice and the Society of Pediatric Psychology. I want to thank all of you who are, I want to welcome all the members of the forum back and welcome all of you who have come to participate. We've explicitly designed this workshop for a lot of rich discussion instead of just presentations. So we're so glad so many of you are here. I want to thank the planning committee who've worked with us on this workshop. I don't want to embarrass you, but if you could raise your hands, the members of the planning committee. It takes a village. And I also want to thank the staff. You'd think that this was the only thing that they were doing, but it wasn't. So they've just been fabulous. A special thanks to Wendy Keenan, who many of you have spoken with. Okay, I want to give you just a little bit of background to the workshop and then walk through the agenda a little bit so that you kind of get primed for how we would appreciate your participation. I'm sure you all know by now that the forum is a group of very diverse members who are together to try to promote children's cognitive, affective, and behavioral health. We want to pay special attention to implementing evidence-based practice and advancing implementation science. But probably many of you know that what public policy tends to pay attention to is problems and crises even more so, and that's just not a good match for children's development. It's much more effective to pay attention to healthy development early on and promote it, and pay attention to preventing problems for kids who are at risk. So that's really what we're all about. Today's workshop, though, has grown out of a special initiative within the forum. About a year ago, several of us formed a learning collaborative to look at how the Affordable Care Act might provide new opportunities to promote children's cognitive, affective, and behavioral health. Over the course of about 10 months, we've had 16 calls with various federal agencies. Some of you are represented today, and we thank you again. And some other related associations or organizations that are in the lead for promoting children's health. I'm not going to go over some of the key points from those calls because I would foreshadow some of what our speakers are going to talk about today. But if there's anything that we've learned in those calls that doesn't get addressed in the workshop, then I'll follow up with that maybe at the end of today. But in many ways, this workshop has grown out of that initiative. We've obviously broadened our scope to not just be limited to the Affordable Care Act or whatever it might be called in the future, or whatever might be left of it, but healthcare reform more broadly and various funding streams. So our workshop today is devoted to paying attention to how we can promote children's behavioral health, how we can make use of innovations, and how we can sustain funding over time. A few key points. You may notice we designed the workshop specifically to have a lot of discussion. So again, I thank most of you who are here to participate in that. We want to try to resist thinking in silos, even though I know, those are going to be apparent. We want to kind of pay attention to where they intersect. The workshop is inclusive of all children. We're taking a population health approach here. So even though we will talk quite a bit about prevention and health promotion, we also want to be attending and thinking about children with special health conditions or behavioral health conditions. We encourage a two-generation approach. That is, considering how to fund programs and services that support not only children, but parents and families. You'll find that that's a key point that runs throughout the workshop and the forum. As probably many of you know, quite a few of the evidence-based prevention and intervention programs involve parents. So we have a real obligation to figure out how to fund those, both on the insurance side and on the prevention side. Okay, here's a couple of key questions that we're looking to answer. Where is it possible for us to drive progress? Where are the gaps in funding? Where do we need more research? What can this forum do? Where and how can we collaborate with you and other stakeholders to have collective impact? So try to organize yourself and your thinking around some of those key questions. Okay, I want to just mention a little bit about our agenda. We've invited a series of panels of experts, as you can see from your agenda. Some of them will be representing funders. Some of them will be representing what we call intermediary organizations. And some of them are what we're calling boots on the ground, who are people actually doing best practices and doing innovations and can help us understand how can they sustain what they're doing and where are the obstacles for them? Where do they get their insecurity from in terms of funding? We're looking for actionable suggestions, so don't be shy. The panelists will engage in moderated discussions with the moderators, but then we will turn to the audience and ask the audience to participate in questions and discussion with the panelists. I want to highlight for you in advance so you can start thinking about this. We have 3 small groups that will meet tomorrow. You'll notice that they overlap quite a bit with each other, but I wanted to kind of identify a little bit about what they are and what they're for and have you start to think about where you want to put your time. There will be an opportunity to contribute to the large group discussion when those groups report back. So it won't be your only chance to have raise some important points. But nonetheless, you're going to have to pick one room to go to and one small group to participate in. So think about these a little bit in advance. You'll see on your agenda, one of the groups is identifying other key priorities for the forum to pursue. So this is a chance for us to do some kind of strategic thinking with you around where are our biggest opportunities for impact. A second group, which overlaps enormously with that, is coordinating a research and service agenda. We're interested in not only identifying where we need more research in order to move programs and services and funding, but how to coordinate that with services. And then the third group is a strategic initiative that the forum has already committed itself to, and that is implementing evidence-based parenting programs in primary care settings. We have a lot of passion about that and a lot of energy, and there's a subgroup of us working on that. David Hawkins and Costello Green are at the helm. But that's a group where many of you can be strategic partners in that one initiative, and that's one of our small groups. So I'm sorry that they overlap so much, but in many ways maybe that means we're on the right track. So we welcome your participation in those groups tomorrow. And then lastly, we're very much looking forward to collaborating with many of you going forward. So today won't be our only chance to invite your ideas and assistance. So thank you again. Okay, with that, just a couple minutes early, we're going to actually get started. I have the incredible privilege of introducing Neil Halfon. Many of you know Neil and certainly know of his work. I'm going to just mention a little bit about Neil's positions, but his biography is in your book, and I'd rather leave the time for him to speak to you. Neil is the director of the UCLA Center for Healthier Children, Families, and Communities. He also directs the Child and Family Health Program in the UCLA School of Public Health and the National Center for Infant and Early Childhood Health Policy. He's professor of pediatrics at the David Geffen School of Medicine at UCLA, Community Health Sciences at UCLA School of Public Health, and Public Policy in the UCLA School of Public Affairs. He divides his time really efficiently, apparently. Many of you know Neil has just sort of revolutionized the way we think about children's health and where health policy might need to go in order to promote children's health, of course, and then, of course, across the lifespan. So we're incredibly privileged that he was willing to come and open our forum workshop today. And with that, Neil.